Welcome back to our channel. Today, we're diving into a topic that's crucial for anyone concerned about kidney health, hidden dangers lurking in your salad bowl. We'll be discussing vegetables that, while healthy for most, can secretly harm your kidneys if you're not careful. Understanding these potential risks empowers you to make informed choices for optimal wellness. Let's get started. Spinach, a beloved leafy green often touted as a nutritional powerhouse, presents potential concerns for individuals with certain kidney conditions. One key concern lies in spinach's high concentration of oxalates. Oxalates can bind with calcium in the kidneys, increasing the risk of kidney stone formation in susceptible individuals. For those prone to kidney stones, moderating spinach intake might be necessary. Furthermore, spinach boasts a significant amount of potassium. The kidneys play a vital role in filtering excess potassium from the blood. However, in individuals with compromised kidney function, the kidneys may struggle to efficiently remove potassium, potentially leading to a buildup known as hyperkalemia. Hyperkalemia can cause a range of health problems, from muscle weakness to potentially dangerous heart arrhythmias. Now, before you swear off spinach entirely, let's talk about a great alternative. Kale. Kale is substantially lower in both oxalates and potassium compared to spinach, making it a safer choice for those managing these specific dietary concerns. And the best part? Kale is no nutritional slouch. It remains a highly nutritious green, offering a wealth of vitamins, minerals, and antioxidants. You can enjoy its rich flavor and impressive nutrient profile without the same level of concern for your kidneys. 12. Potatoes, a staple in many cultures and a go-to comfort food unfortunately, make our list due to their naturally high potassium content. Now don't get me wrong, potassium is essential for a healthy body. It plays a vital role in nerve and muscle function, helps maintain fluid balance, and even keeps our blood pressure in check. However, as with many things in life, balance is key. For individuals with healthy kidneys, moderate potassium intake from potatoes shouldn't be a problem. Our kidneys do a fantastic job filtering and excreting excess potassium, keeping things in equilibrium. However, the story changes for those with kidney problems. When the kidneys aren't functioning optimally, they may not be able to efficiently remove excess potassium from the bloodstream. This can lead to a condition called hyperkalemia, characterized by elevated potassium levels. Hyperkalemia is a serious concern for individuals with kidney issues, as it can trigger a cascade of health problems. One of the most concerning is its impact on the heart. Hyperkalemia can disrupt the heart's electrical activity, potentially leading to irregular heartbeats, arrhythmias, and in severe cases, even cardiac arrest. Muscle weakness is another common symptom of hyperkalemia. Elevated potassium levels can interfere with the normal functioning of muscles, causing weakness, cramping, and in extreme cases even paralysis. Now, for those concerned about potassium intake due to kidney issues, sweet potatoes can sometimes be a better alternative when consumed in moderation. Sweet potatoes generally contain slightly lower levels of potassium compared to regular potatoes. However, it's crucial to remember that sweet potatoes still contain potassium, and therefore portion control is essential. A registered dietitian specializing in renal nutrition can provide personalized guidance based on individual kidney function, overall health status, and other dietary needs. Self-managing potassium intake without professional advice can be dangerous. Tomatoes, juicy and bursting with flavor, are a kitchen staple, adding zest to countless dishes. They're packed with vitamins, antioxidants, and yes, you guessed it, potassium. While this mineral is essential for healthy nerve and muscle function, it's the potassium content in tomatoes that requires a closer look, especially for individuals with kidney disease. For those managing kidney disease, maintaining a healthy potassium level is crucial. When kidneys aren't functioning at their best, they may struggle to filter out excess potassium from the blood effectively. This can lead to a buildup of potassium, a condition known as hyperkalemia. Hyperkalemia is a serious concern for those with kidney disease, potentially causing a range of health complications. One of the most significant risks is the development of irregular heartbeats, also known as arrhythmias. Now, before you banish tomatoes from your diet entirely, let's talk about a delicious and kidney-friendly alternative. Red bell peppers. Red bell peppers offer a similar vibrant color and slightly sweet flavor to many recipes while containing significantly less potassium than tomatoes. By substituting red bell peppers for tomatoes, individuals with kidney disease can enjoy flavorful meals without compromising their health. Remember, making informed choices about the foods you consume can make a significant difference in managing your kidney health. Beet greens, those often discarded leafy tops of beetroot, have gained popularity in recent years for their impressive nutritional profile. And for good reason. They're chock full of vitamins, minerals, and antioxidants, making them a healthy addition to any diet. However, for individuals with pre-existing kidney conditions, beet greens require a cautious approach. While packed with nutrients, beet greens also contain high levels of oxalates and potassium. For individuals with pre-existing kidney conditions, this combination can potentially worsen their symptoms and elevate the risk of developing kidney stones. Oxalates can bind to calcium in the kidneys. This binding process can contribute to the formation of kidney stones, particularly calcium oxalate stones, which are the most common type. Additionally, the significant potassium content in beet greens can further challenge compromised kidneys. Now, if you're looking for a leafy green with a similar visual appeal but a gentler impact on the kidneys, consider substituting with arugula. Arugula is notably lower in oxalates and potassium, making it a kidney-friendly choice. Furthermore, it offers a delightful peppery flavor that can enhance your dishes just as beet greens would. You can use it in salads, sauté it as a side dish, or incorporate it into various recipes. Avocados, creamy, delicious, and often associated with healthy eating, find themselves on our list due to their surprisingly high potassium content. While avocados are technically fruits, we often use them in savory dishes like salads, sandwiches, and of course, guacamole. One noteworthy characteristic of avocados is their significant potassium content. A single avocado boasts approximately 690 milligrams of potassium, a mineral vital for maintaining healthy blood pressure and nerve function. However, for individuals managing potassium intake due to kidney conditions or other health concerns, this high level may be a consideration. Remember, potassium, in and of itself, isn't bad. In fact, it's an essential mineral that our bodies need to function correctly. However, for individuals with compromised kidney function, maintaining a healthy potassium balance requires careful attention to dietary intake. As a creamy, low-potassium substitute in various recipes, consider using cucumber slices or zucchini. These vegetables offer a refreshing crispness and can be pureed or blended to achieve a similar texture to avocado in some applications, while providing a significantly lower dose of potassium. 11. Rhubarb, with its tart flavor and vibrant red stalks, is a favorite ingredient in pies, jams, and other sweet treats. However, beneath its culinary appeal lies a potential concern for individuals prone to kidney stones: oxalates. Rhubarb contains a significant amount of oxalates, naturally occurring compounds found in many plants. High oxalate levels in the body can contribute to the formation of kidney stones, particularly calcium oxalate stones, which are the most common type. Individuals who are already prone to developing calcium oxalate kidney stones or have a history of kidney problems should be especially cautious about consuming large amounts of rhubarb. So, who needs to be particularly cautious about rhubarb consumption? Those with a personal or family history of kidney stones, particularly calcium oxalate stones, are at a higher risk. Certain medical conditions that affect oxalate metabolism can also increase susceptibility. If you fall into these categories, it's worth discussing your dietary choices with a healthcare professional. Now, if you enjoy rhubarb but want to minimize the risk of oxalate-related issues, there are a few strategies you can try. First and foremost, moderation is key. Consuming rhubarb in moderation, rather than as a regular part of your diet, can help manage oxalate intake. Another helpful tip is to boil rhubarb before using it in recipes. Boiling can help reduce the oxalate content, although it's important to note that it will also leach some nutrients. Make sure to discard the boiling water after cooking rhubarb to further minimize oxalate consumption. Additionally, consuming rhubarb with calcium-rich foods like dairy products or calcium-fortified alternatives may help bind oxalates in the gut, reducing their absorption into the bloodstream. Pairing rhubarb with a source of calcium can be a helpful strategy for those concerned about kidney stone formation. If you're looking for a similar tart flavor in your recipes without the oxalate concerns, consider using strawberries or raspberries. These berries offer a delicious and generally safer alternative for individuals concerned about kidney stone formation. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. Understanding the potential impact of certain foods on your kidneys empowers you to make informed choices for your health. See you next time.